Greetings to you. My name is Rachel Williams Rollins. I will be presenting my slides on reducing hospital readmissions to improve outcomes and financial stability. My first slide says a list of healthcare issues. The content of this presentation will include economic impact of hospital readmission, feasibility of the suggested intervention, risk analysis, cost-benefit analysis, initiative benefits, ethical concerns, and cultural concerns. Slide 3 speaks of the economic impact. Hospital readmission rate is a critical issue affecting healthcare systems in the United States. The annual cost of Medicare is $26 billion. Patient readmission can be prevented. High patient readmission rates have financial implications of organizations. It increases the burden on healthcare staff due to strain on the resources. It reduces the organization's market share. It yields negative brand image. Slide 4 tells us feasibilities of the suggested intervention. Multidisciplinary collaboration, medication reviews, telehealth program, medication reconciliation initiatives, patient literacy programs, using electronic health record systems to identify patients at high risk, patient support post-discharge. On slide 5, we speak of a cost-benefit analysis. Annual implementation cost is at $250,000. The annual savings from prevented penalties, $600,000. Reduce stiff burnout. It reduces strain on available resources. It says that cost-benefit analysis, a systemic process of evaluating the desirability of a decision by weighing its potential benefits and costs. On slide 6 is the risk analysis again. The staff members are subjected to various types of risk. There's financial risk, there are operational risk, and there's reputational risk. And I think that last one is a stickler pretty much in the situation or the job that I am currently in. I work for the Veterans Affairs, and that last risk analysis there is really a stickler for us, and we've been working around doing some things to better that for the facility as a whole and as well as our veterans. On slide 7, it says the advantages of the initiative is improved health and patient outcomes, reduce hospital penalties and improved financial standing, reduced patient readmission rate, improved patient satisfaction and brand reputation, improved workflow management, improved honesty and transparency, improved health outcomes in the long run. Then there are cultural considerations, overcoming cultural barriers in health care service provision, overcoming language barriers when offering the stage instructions, responding to the social, it's like the determinants of health, engaging patients and relatives in decision making. The last, engaging patients and relatives in decision making, that's a whole form of different cultures. Cultures are different, and we have to take that in account when we speak of cultural considerations. There are many different cultural considerations to take in, some that we don't practice, a lot that we don't practice, but we have to be willing to take that in considering the outcomes and treating different patients. Everybody's different. No treatment is the same, the exact same. So cultural considerations are something that's a stickler. That is a good point. That is pretty much, to me, the start of admission to discharge. That's what I do every day. Ethical considerations. is complying with professional duties to enhance care quality, to protect and respect patients' autonomy through patient participation in decision making, maintaining fairness and justice, communication, clarity, and informed consent, promoting patients' best interests and preventing harm. Conclusion. The bottom line is that patient regulation rates within 30 days affect patient well-being and have financial implications for the system. It is important to adopt a feasible program to overcome the issue. The initiative must be well aligned with the organization's overall mission and vision and must promote care continuity and coordination. It is important to work closely with all stakeholders and practitioners to improve the well-being of the patients through proper follow procedures and adoption of digital technology to improve patient care. My references are listed on slide 11. And drawing my own conclusion, I deal with veterans, different backgrounds, different cultural beliefs. I deal on the end of the financial. It is my job to advocate for the veterans, for the patient. And within the realm of this presentation, there are a lot of things that I could collaborate on, and that there are a lot of risks when it comes to healthcare issues these days. Costly risk, the readmissions, going back into the hospital for the problem that was not resolved with the previous admission or admissions. So that's costly to the insurance companies, to the patient, to the staff, as stated before, because if they're back for the same issues, somewhere there's missing resources. Thank you for your time and thank you for listening. Again, I am Rachel Williams Rollins. Thank you.